As the incidence of diabetes mellitus increases worldwide, understanding its diagnosis and management becomes crucial. At its core, diabetes is a disease of glucose regulation. The body attempts to maintain blood glucose within a normal range. Because nutrient intake, physical activity, and other factors fluctuate throughout the day, so do blood glucose levels. The body has mechanisms, though, that prevent blood glucose levels from becoming too high or too low. Elevated glucose in the blood is known as hyperglycemia. When hyperglycemia occurs, the beta cells of the pancreas release the hormone insulin. Insulin helps move glucose from the blood and into body cells, thus lowering blood glucose levels. Low blood glucose levels are known as hypoglycemia. In this case, to restore balance, the pancreas releases the hormone glucagon. Glucagon stimulates the liver to release glucose into the blood. Additional hormones such as epinephrine, cortisol, and growth hormone may also help elevate blood glucose levels. Let's get back to what this has to do with diabetes mellitus. Diabetes has two primary types, and both are characterized by high levels of blood glucose, which we now know is called hyperglycemia. In type 1 diabetes, there is a lack of insulin. Most commonly, this is caused by autoimmune destruction of the beta cells of the pancreas. Remember, insulin moves glucose out of the blood and into the cells. In type 2 diabetes, the pancreas can produce insulin, but the cells have become resistant to accepting it. The body responds by producing even more insulin, but the insulin remains unable to carry out its work. Blood glucose levels stay elevated. Risk factors for type 2 diabetes include obesity and lack of physical activity. Fat cells are particularly resistant to insulin. How is diabetes diagnosed? Remember, it is a disease of hyperglycemia, so diagnosis is based on blood glucose testing. There are three common methods: fasting blood glucose level, oral glucose tolerance test, and glycated hemoglobin test, also called the A1C test. The A1C test can assess blood glucose control over the preceding 3 months. Diabetes has serious potential complications. Managing blood glucose levels is key in treatment. With type 1 diabetes, insulin is always needed. Medical management of type 2 diabetes often requires a stepwise approach. The first step is lifestyle modifications, followed by monotherapy of an oral anti-diabetic agent. If these are not effective, a combination of oral anti-diabetic agents may be required. Finally, if glycemic control is still lacking, exogenous insulin may be added to the plan. There are 3 key areas of lifestyle modifications. Patients should try to achieve and maintain ideal body weight through a low-fat, low-sodium diet with carbohydrate counting, or a diet planned around glycemic index and regular meal schedules. Exercise helps to maintain weight and stimulate uptake of glucose. Individuals with diabetes must be careful of hypoglycemia. Insulin may need to be reduced prior to exercise. It is also necessary for patients to self-monitor blood glucose levels, maintain blood pressure and blood lipid levels within normal limits, and participate in periodic cardiac assessments. If health maintenance alone is not effective, oral anti-diabetic medications may be prescribed. To understand oral medications, let's review the key players in glucose regulation. The liver produces glucose if needed, which adds glucose to the blood. The small intestines absorb glucose, increasing blood glucose levels. And the pancreas, as we know, releases insulin to lower blood glucose, moving it out of the blood and into the cells. Different oral medications affect different key players. Sulfonylureas and meglitinides help the pancreas produce insulin. The biguanides and thiazolidinediones do 2 things: prevent the liver from producing more glucose for the blood and help cells become more sensitive to insulin. Some patients with type 2 diabetes require insulin therapy. All patients with type 1 diabetes require insulin treatment. All insulin is injectable. There are 2 categories: conventional, which are synthetic human insulins, and insulin analogs, which better mimic endogenous insulin's effects. Insulin is also classified based on its onset of action. Rapid acting has a time of onset of 30 minutes to 1 hour. Intermediate acting has an onset time of 2 to 4 hours. Long acting has a time of onset from 3 to 10 hours. Each patient's insulin regimen is matched to that individual patient's needs. Regardless of treatment regimen, all management strategies are aimed at maintaining glucose within normal range.